In today's video, we're going to be talking about diabetes. Diabetes is when your body is unable to make use of the glucose that you've got in your body. And we've got multiple types of diabetes. We've got type 1, type 2, and gestational diabetes. But in today's video, we're going to be talking about type 2 diabetes. And the major focus would be on microvascular complications. What are microvascular complications and what are the microvascular complications that we have? Microvascular complications are a group of severe complications but with frequently mild illnesses that affect the body's tiny blood vessels. So these complications are better managed when they are early detected, according to research carried out by Nathan et al. In the year 2005. As Nathan et al. Has said, that early detection helps in quick intervention of these complications. So we'll be looking into the microvascular complications. Microvascular complications occur when there's consistently elevated blood glucose level, when your body's blood glucose level is consistently high. And we've got the microvascular triad. They consist of diabetic retinopathy, which affects the vision, diabetic neuropathy, which affects the nerves, and diabetic nephropathy, which affects the kidney. So we're looking into this triad one after the other. Sadly, many of these complications may be asymptomatic when they newly started, and then you begin to see their symptoms when the complication is severe. So how can these complications be detected early, and how can it be prevented? So we're starting with diabetic retinopathy. Diabetic retinopathy affects the vision. How can you detect diabetic retinopathy early? This can be done by annual check of your sight. Checking your vision annually would help in early detection. Good glucose control would help in regulating your blood glucose level, which would prevent the complication or delay the onset of the complication. Diabetic retinopathy. So diabetic retinopathy affects the vision, and retinopathy could actually start with a very mild alterations to your vision. It could start with microaneurysm, retinal hemorrhage, before it becomes severe, and you could actually get to know all of these in time by checking your vision annually if you've got diabetes. Annual dilated eye examination would help in early detection of retinopathy. Diabetic retinopathy affects the vision, and there are some key risk factors that could lead to diabetic retinopathy. Poor glucose control, uncontrolled blood pressure, long-term diabetes. And all of these things could be managed with early detection. And according to a study carried out by Safi et al. In the year 2018, it's been identified that annual dilated eye examination would help in early detection of retinopathy. Moving on to the second one, diabetic nephropathy. Diabetic nephropathy as well could actually begin quietly. You might not get to know when it starts. It might begin silently as low as microalbuminuria, and it then progresses into renal failure. And diabetic nephropathy stems from 1. Thickening of the glomerular basement membrane, 2. Mesangial growth and inflammation. According to a study carried out by Routines in the year 2013, prevention requires regular urine albumin levels monitoring, good control of the body's blood pressure, and good blood glucose level control. Moving on to the third one, diabetic neuropathy. Diabetic neuropathy affects the peripheral nervous system, and they affect the limbs, that's the feet and the hands. They affect both your upper limbs and your lower limbs. And the symptoms may include tingling, numbness, and discomfort, delay in wound healing, and loss of sensation. The study was carried out by Pobusui et al. In the year 2017, where diligent foot care, good glycemic control, and quitting smoking has been discovered to help in the delay or prevention of diabetic neuropathy. Looking into the microvascular complications, we would like to emphasize on these risk factors: poor glycemic control, smoking, obesity, absence of exercise, long-term diabetes, and extended period of hyperglycemia. These are the risk factors that are common to all of these microvascular complications. And how can these microvascular complications be prevented generally? 1. Good glycemic control, effective exercise, diet control, and lifestyle modifications. And specifically for retinopathy, getting yearly eye screening, yearly kidney screening, and nerve screenings would help in early identification, prevention, and de-escalation of these complications. I'll see you in my next video. Thanks for watching. Bye.